Imagine waking up at 3 o'clock in the morning with that strange, heavy feeling deep in your lower abdomen. You walk to the bathroom half asleep, sit down on the toilet, and nothing happens. You wait, you strain a little, you try to relax, but your body simply won't cooperate. So you think, maybe it's just constipation. You make some coffee, walk around the house, try again an hour later, still almost nothing. But now the discomfort is changing. It's no longer just constipation. There's pressure deep inside your abdomen. A strange heaviness in your lower back, pain radiating into your pelvis. Your body starts feeling bloated, exhausted, irritated. And suddenly, a quiet question appears in the back of your mind. What if this is something more serious? If this situation sounds familiar to you, pay very close attention to the next few minutes. Because today, we're going to talk about a condition that becomes extremely common after the age of 60, yet almost nobody discusses it honestly. And even worse, many people ignore the warning signs until it turns into a genuine medical emergency. My name is Dr. William Bennet, and today we're going to talk about something that may seem minor at first, but can become extremely dangerous. Stool trapped and hardened inside the rectum, what doctors call fecal impaction. We're going to discuss why this happens, the warning signs your body sends before things become serious, the symptoms that confuse almost everyone, and most importantly, what you should do immediately to avoid dangerous complications. And I promise you something. By the end of this video, you'll understand your digestive system in a way that very few people ever do. Before we continue, tell me in the comments below, where are you watching from today? I genuinely enjoy reading your comments and learning who is part of this community. Now let's talk about the most important issue. Most people treat digestive problems like a small inconvenience, something temporary. It'll pass. Maybe I just need more fiber. I'll drink some prune juice tomorrow. But a fecal impaction is not ordinary constipation. Imagine a pipe completely blocked by a hardened rock. It doesn't matter how much water flows through the pipe, that blockage won't easily move. And that is exactly what happens inside the intestines of many adults over 60. Your large intestine has one major job: removing water from stool. It does this constantly. The problem is that when stool remains inside the colon for too long, the body keeps extracting water hour after hour, day after day. What began as soft stool slowly transforms into a dry, compacted mass that can become almost as hard as clay. And here's the dangerous part. This rarely happens overnight. In most cases, the process develops slowly and silently. Many people go 4, 5, even 7 days without fully emptying their bowels. During that time, they may still pass small amounts of stool, creating the false impression that everything is working normally. But it isn't. No, it truly isn't working normally. A small portion comes out, while a much larger amount remains trapped inside, becoming harder and harder. And this is especially important after the age of 60 because aging changes the entire digestive system. The intestinal muscles naturally slow down. Rectal sensitivity decreases. The body feels less thirst. Many medications reduce intestinal movement. Blood pressure medications, antidepressants, iron supplements, calcium, pain medications, all of them can significantly slow the bowel. So this does not mean your body has failed, and it does not mean you did something wrong. It is often the result of several silent biological changes happening at the same time, changes that almost nobody properly explains to older adults. Now pay very close attention because the next part could prevent you from making a dangerous mistake. There is one symptom that confuses thousands of people: watery diarrhea. Yes, you heard that correctly. It is surprising but true. Many people have a severe fecal impaction and believe they have diarrhea. How does that happen? When a hardened mass completely blocks the rectum, newer liquid stool from higher in the colon starts leaking around the edges of the blockage. The person sees liquid coming out and thinks, well, I can't be constipated. But the opposite may actually be true. This is called overflow diarrhea. And here's where things become dangerous. Many people take anti-diarrheal medication. That can dramatically worsen the situation. It leads to a cycle of pain. Because those medications slow intestinal movement even more, the colon becomes slower. The blockage hardens further, the pressure increases. So if you're experiencing watery discharge together with abdominal heaviness, rectal pressure, or difficulty passing stool, do not take anti-diarrheal medication without medical guidance. Now there's another surprising symptom that many people never connect to the intestines: difficulty urinating. You feel the urge to urinate, you go to the bathroom, but only a weak trickle comes out. Or you suddenly feel the need to urinate constantly without fully emptying your bladder. Do you know why? Let me explain the biology behind it. Because the rectum and bladder sit extremely close together inside the pelvis. When the rectum becomes swollen and distended with hardened stool, it can physically press against the bladder and urethra. And in severe cases, this can even lead to urinary retention. Now, I want to talk about symptoms that are very often overlooked, but may indicate that the intestines are under much more stress than people realize. The first one is lower back pain. Many people assume it's arthritis, a spinal problem, a pulled muscle. But when there's significant pressure inside the rectum, that tension can radiate into the lower back, hips, and even down the legs. And here's the problem. Because the pain doesn't seem digestive, people completely ignore the true cause. Another extremely important symptom, especially in older adults, is sudden mental confusion, disorientation, irritability, agitation, sudden changes in behavior. I know this sounds strange, but in seniors, severe fecal impaction can create enough physical stress in the body to affect mental clarity, and many families never realize that the intestines may be contributing to those cognitive changes. Now, I need to be very direct with you. A fecal impaction is not simply uncomfortable constipation. It can become a serious medical emergency, and I want to explain exactly how that progression happens. First, the intestinal wall becomes overstretched. The bowel expands beyond its healthy capacity. Blood flow to that tissue begins to decrease. The intestinal muscles become weaker. The colon loses its ability to push stool forward properly. Then the pressure starts spreading upward into higher parts of the colon. The abdomen becomes visibly swollen. Nausea appears. Appetite disappears. The person starts looking genuinely ill, and eventually we reach the most dangerous complication of all. Bowel perforation. There is a physical limit to how much pressure the intestine can tolerate. If that limit is exceeded, the intestinal wall can tear. And when that happens, bacteria and fecal material spill into the abdominal cavity. The result is a life-threatening infection called peritonitis. I'm not telling you this to frighten you. I'm telling you because ignoring the warning signs can have very serious consequences. Now pay close attention to the symptoms that require immediate medical attention. Severe, constant abdominal pain. A hard, rigid abdomen. High fever. Persistent vomiting. Complete inability to pass gas. Sudden confusion. Cold sweats. Low blood pressure, or fainting. If these symptoms appear, do not wait at home hoping things improve. Seek emergency care immediately. Now let's talk about something practical. What should you do if stool feels completely stuck? First rule, stop straining. This is extremely important. The harder you push, the more compressed the blockage becomes, and the more irritated and inflamed the tissue gets. Excessive straining can also trigger hemorrhoids, rectal tears, and dangerous blood pressure spikes, especially in older adults. So let's discuss the first appropriate intervention. Glycerin suppositories. They are available over the counter and can be very helpful during the early stages. But there's an important detail most people don't know. In more significant impactions, one suppository is often not enough. Many physicians use 2 or even 3 at the same time in adults with severe rectal blockage. Now pay attention to the correct method. Do not stand up. Lie on your left side. This position helps align the rectum and sigmoid colon, allowing gravity to assist the process. Use a water-based lubricant. This matters because the tissue is usually already irritated and inflamed. Then gently insert the suppositories as deeply as possible. And here comes the most important part. Do not get up immediately. You must remain lying down for at least 30 to 45 minutes. The glycerin needs time to melt, lubricate the area, and soften the outer layer of the hardened stool. If you stand up after 5 minutes and rush to the bathroom, you'll probably accomplish nothing. After enough time has passed, go to the bathroom calmly. Do not force aggressively. If it works, wonderful. If not, stay calm. The next step is gentle walking, warm water, and repeating the process after about an hour. Very often, the first round softens only the outer layer. The second round reaches the center of the blockage. And I want to make something absolutely clear. If you have tried this properly twice and nothing happens, do not spend days continuing to struggle at home. That is the moment to seek medical care. because hospitals have stronger enemas, imaging tests, and medical procedures designed specifically to remove severe impactions safely. There comes a point where the blockage becomes so severe that the body simply cannot remove it naturally anymore. And that is when some patients require a procedure called manual disimpaction. I know the name alone sounds frightening, but I want to explain it calmly because fear becomes much worse when people don't understand what actually happens. During this procedure, a physician uses gloves, lubrication, and specialized techniques to carefully break apart and remove the hardened stool manually. In more severe cases, this is not performed while the patient is fully awake. Sedation or medication is often used to relax the muscles and prevent significant pain. And despite sounding extreme, many patients describe an almost immediate sense of profound relief once that internal pressure disappears. But here is the single most important point in this entire video. Removing the current blockage is not enough. Because if you do not correct the underlying causes, the problem usually comes back. And most of the time, it returns faster the second time. That is how many older adults become trapped in a dangerous cycle of chronic constipation and repeated fecal impactions. So now, let's talk about real prevention. Number 1, hydration. Water is not a small detail. Water is the foundation of everything. Your intestines depend on water to keep stool soft and easy to pass. And after the age of 60, something very deceptive happens. The sensation of thirst decreases dramatically. Many older adults remain mildly dehydrated almost all the time without realizing it. That is why I tell my patients, do not wait until you feel thirsty to drink water. Try to drink 6 to 8 glasses throughout the day, especially 1 large glass first thing in the morning. That simple habit activates a natural intestinal reflex called the gastrocolic reflex. In simple terms, when fluid enters the empty stomach, the intestines receive a signal to start moving. The second major factor is physical movement. Your intestines are not passive tubes. They are made of muscle tissue that constantly contracts in wave-like motions to move waste forward. And here's something fascinating. Walking directly stimulates those intestinal contractions. Even a gentle 20-minute walk after meals can significantly improve intestinal transit. And older adults with mobility limitations can still benefit from seated exercises, gentle stretching, or simple torso movements. One of the worst things for digestion is remaining seated for hours after eating. Now I need to address something extremely important. Medications. Many common medications slow down the intestines. Opioid pain medications, antidepressants, iron supplements, calcium supplements, antihistamines, diuretics, and especially certain blood pressure medications known as calcium channel blockers. This does not mean you should stop taking your medications on your own, but it does mean you should have a very honest conversation with your doctor about constipation. Ask directly, could any of my medications be affecting my bowel movements? In many cases, alternative options may exist with less impact on digestion. Now let's talk about another extremely common mistake, relying on stimulant laxatives every day. These laxatives work by chemically forcing the intestines to contract. In the short term, they may help. But when used daily for weeks or months, the intestines can begin depending on that artificial stimulation. Over time, the bowel gradually loses part of its natural ability to function independently. This is called laxative dependency, and it is far more common in older adults than most people realize. If you use stimulant laxatives frequently, speak with your physician before stopping abruptly. Now, there is another incredibly simple strategy that can dramatically improve bowel function. Consistency. Your digestive system works best with routine. There is a particularly powerful window in the morning, especially during the first 30 minutes after waking up or after breakfast. That is why I recommend something very simple. Sit on the toilet at the same time every morning, even if you don't feel a strong urge. Relax for 5 to 10 minutes. No phone, no anxiety, no aggressive straining. Over time, your body begins synchronizing naturally with that schedule. And now, I want to share one more change that many people completely underestimate. Toilet posture. The human body was never designed to eliminate waste while sitting at a perfect 90-degree angle. When your knees are elevated slightly above your hips, the rectum relaxes much more effectively. And that can dramatically improve bowel movements. A small footstool under your feet can completely change the mechanics of evacuation. It sounds almost too simple to matter. But for many older adults, this single adjustment creates a major improvement. Now I want to speak directly to the sons, daughters, spouses, caregivers, and family members who may be watching this for someone they love. Because many older adults do not fully recognize how serious this condition can become. And in bedridden seniors or people with limited mobility, fecal impaction can progress much faster than most families realize. If an older adult has gone 3 or more days without a proper bowel movement, if they are complaining about abdominal pressure, lower back pain, loss of appetite, confusion, unusual irritability, or constant discomfort, please do not ignore those signs. In frail older adults, the intestines are less resilient. The body tolerates inflammation poorly, and complications can escalate quickly. That's why early action matters so much. Offer warm fluids throughout the day. Help them walk or change positions frequently. Encourage gentle body movement whenever possible. And if you suspect a fecal impaction, seek medical evaluation without embarrassment or hesitation. This condition is far more common than most people think. And now I want to briefly summarize the most important things I need you to remember from this video. First, fecal impaction is not ordinary constipation. It is a serious condition that develops gradually and can become a genuine medical emergency. Second, the symptoms can be extremely misleading. Watery diarrhea, difficulty urinating, lower back pain, mental confusion. All of these symptoms may be directly connected to impacted stool. Third, never continue aggressive straining for hours or days trying to force the problem out. That often makes the compression worse and increases the risk of injury. Fourth, the most common first-line approach includes hydration, gentle movement, proper positioning, and glycerin suppositories used correctly. But if those measures fail, medical care is necessary. And fifth, long-term prevention depends on consistent daily habits. Drink enough water. Move your body regularly. Review your medications with your doctor. Establish a bowel routine. And improve your toilet posture. Your digestive health affects far more than bowel movements. It influences your energy levels, your comfort, your sleep, your mental clarity, your independence, and your overall quality of life after 60. The problem is that many people feel embarrassed talking about constipation, but ignoring your intestines does not make the problem disappear. In fact, the earlier you recognize the warning signs, the easier it becomes to avoid serious complications. If this video helped you in any way, make sure to leave a like and share it with someone who may need this information. And tell me in the comments below, have you ever struggled with persistent constipation after 60? What helped you the most? I read many of the comments personally, and I truly like understanding the real challenges people are facing. And if you want more honest, straightforward health information explained in simple language for adults over 60, subscribe to the channel. Here, we talk about the things that truly matter for aging safely, maintaining independence, and protecting your quality of life. Take good care of yourself. Drink your water. Listen to the warning signs your body sends you. And never ignore what your intestines may be trying to tell you.